while a lot of companies are collecting data on skills, they're collecting on experience and things like that. Employee health, like for example, I don't see companies wanting to know how many of my employees are pre-diabetics, for example, or how many of my employees are borderline obese. So this is something like Loop is a healthcare company. So we are trying to educate a lot of customers, a lot of companies to say, capture this data so that you can plan interventions so that you have a healthier workforce. I think you were touching upon the value of that. As long as the outcome is for the betterment of the employee and not for any other consideration and judgment.
Yes, because I think it works in both the favor of an employee and the organization. See, sedentary lifestyle is something that's set in post-COVID.
Yeah.
During the COVID, and at GamesKraft we have been focusing on how are we getting an active lifestyle for people. So obviously, without getting into the specifics of who is pre-diabetic or in that or obese, etc., we try to see the data at a org level, okay, and we'll use it in from what kind of interventions we have to plan with a partner in terms of creating awareness. For example, smoking, or I'm saying that obesity or cholesterol levels, okay. Now all of those are the interventions that can be set up to make people aware what are the downside to you not taking care of it, because sometimes it happens, and I think very often we are hearing stories about at young age people getting heart attacks and all that. All of that can be avoided in case we have programs that sensitize the demographic age in terms of 30 to 45, in terms of what are some of the things that can happen. In India, medical is still not such a big issue. In US, it's a big issue. And the cost involves, etc. And I think if you start looking at preventive, it makes a lot of difference in terms of the medical budgets or the premiums that you end up paying as an organization.